Summer is here, and it is so important to take care of your skin, and that's why I'm at the place that takes care of my skin and the person who takes care of my skin. Lindsay Wilson, thank you so much for having us here.
Thank you for coming.
To Wabash Valley Dermatology and Med Spa. You have taken care of me and helped educate me over time in the importance of taking care of my skin. And I want to take this time as we're entering the summer season to really emphasize to viewers how important it is to take care of your skin. And sunscreen, we should be using it every day, all year long.
Every day, all year.
Let's talk about the importance of now.
Yeah, so sunscreen, I like the application to start first thing in the morning before you go outside. Reapply every 2 hours, depending on if you are swimming or sweating, but it's very important even if you're going in the car on your way to the store, that accumulation of sun over time will really have an impact on your skin.
Yeah, you know, I now use body lotion, I use face lotion, I use all the things that have it already in the product. And there's so many products today that that's really what they're designed to do.
There really are, and there's a lot of literature out there that discusses what's the type of sunscreen should you have and what SPF number are we looking for. I think it's not as important to focus so much on the number or the ingredients as much as something is better than nothing. Mm-hmm. Mineral-based is, in my opinion, better than chemical-based sunscreens, and there are some great ones out there that you can apply with zinc and titanium dioxide that will rub in. Some of the cheaper brands are harder to rub in because that zinc is really thick, and it's all about molecular weight and how you can get that to rub in.
Yeah. You see a lot of people, I assume, all year long, but in the summer months, as people are starting to tan and they're starting to see the moles and they're starting to see the areas that may be of concern to them, how important is it to become a regular patient with someone like you?
It's really important for everyone to come in yearly for skin checks because early detection and diagnosis is extremely important. I have a population of patients who don't want, they're fearful of scarring. And so if there's something topically even, we can write a prescription for creams to treat some of this superficial precancers or cancerous lesions. That would be great, but early detection is best.
Yeah, and I think some people are just afraid. They are afraid of what they're going to find out when they see you.
They're afraid they're going to find out, and that's okay. We're here. We have availability. I will add patients in within the week. I have a lot of friends of mine who are doctors in the area, nurse practitioners, and they have my cell phone number, and I always tell people, don't hesitate to call us and we'll get you in.
Yeah, you do a great job with that. And you know, I want to address the moms and dads out there and grandparents with their children, because I've heard it said, the more burns you have as you age, the more it impacts your chances, right?
Yes, it does. So the radiation from the sun changes the DNA of the skin cells, and the more burns you have, scientific evidence shows you have a greater increased chance of developing all types of skin cancers, squamous, basal cell, and melanoma.
So that's why it's so important that we take care of our kids then.
Yes.
I mean, really. Because I know that it's a pain. Having been that mom that you're like, your child's like, I don't want any sunscreen.
Yeah.
No, it's so important.
Yeah, and you can find the right type. We just happened to go to Florida, and I had an SPF 30 on my family that was mineral-based, and when that 30 ran out, we switched it to a 50, same maker, but just a different version, and we actually had less of a protection with that type, and it was a 50. So I think the importance is find what works for you, what's effective, what rubs in, and what's easiest for you to get applied on your children before they take off.
So I've heard you say in the past, there's really kind of an ABC sort of way to make sure that you're following those moles and knowing what to check. Can you tell me about that?
So we go by what we call ABCDEs of melanoma or skin cancers. And so A is asymmetry, B is border, C color, D diameter, anything bigger than a pencil eraser, or E evolution, anything changing. And I always tell my patients that if they can maybe be breaking one of those rules and it still looks okay when I look with my dermatoscope. More times than not, if they're concerned with anything, I want them not to hesitate to come in and have me take a look at it for biopsy.
Yeah. And I've done that before. And you know what?
Yeah.
I'm so grateful for the time that you've spent with me. And I know that's the time that you spend with so many patients.
Yes.
So if we have somebody watching who says, okay, well, she's just convinced me, I got this mole that I need her to look at. How does that work? How do they schedule appointments?
They can call us at 812-917-7252. We're open 5 days a week. And one late day, we're here till 7 o'clock, 1 day a month.
Awesome. So always time. Make the time, right?
Yep.
So important to do. Well, once again, it's Wabash Valley Dermatology and Med Spa. Lindsay Wilson, she's the best. And I thank you so much for allowing us to come back in and talk summer skin.
Yeah. Thank you so much for coming.
It's the summer season.
Yeah.
Get your sunscreen. Take care of yourself.